My name is Amol Nirgadkar. I'm the CEO of Patient Prism, and I'm delighted to welcome Judy Kay Mausolf in our studios. And this morning we're talking about culture and building better leaders and teams so that we can perform at our peak. You know, Judy Kay has written 2 amazing books, Tada, Get Happy in 5 Seconds or Less, and Rise and Shine, and she speaks all over the country on how to build effective teams and for success. The question to you, Judy Kay, is that, I've attended some of your speeches and everybody's like, wow, this was amazing. Okay, and then I come back, or a doctor comes back and they get busy and they get back to what they're doing. Yeah. So implementation is a very big challenge in every organization, whether it's a dental office or not. How do we implement better? What are the steps? What should we do to be able to implement the ideas that we're learning in a systematic way?
So it really starts with probably the easiest way to implement something from a meeting or a course is to not divide and conquer, but actually take your entire team to the same course. Okay. Because you're hearing the same message, and that's so important. What I usually see is this team member goes to this course, this team member goes to that course, another one, doctor goes to another course, and they come back to the practice and they start sharing ideas. But it's hard to repeat that secondhand, right? Sure. So it's much more effective to have the entire team attend the same course and then do a quick debrief after that as a team and say, what do we want to bring back to the practice? And then pick one thing to start with. What's the number one thing that would impact our practice the most? Sure. So then we go back to the practice and we have a team meeting and we discuss using my R.I.S.E implementation process. Here's another acronym for you. Just, I told you I'm an acronym addict. So R.I.S E, the R in it is for to review. So let's say we're going to implement maybe asking our patients for referrals because we want to build a bigger referral base, right? And we want to build, so the R is what are we currently doing? Well, maybe we're not doing anything or we're waiting for patients to bring up something to us. So, okay, let's talk about what's the benefit and is there a benefit to change to starting to ask? Well, the value has to be from 8 to 10 of value in change. Well, there'd be a great value in getting patients to refer patients because the trust level would be much higher. We'd have better quality patients, right? So that's the R, the review, is determining the value, what we're currently doing, and is there enough value to make the change. Sure. The I is actually the implementation process. And this is where we fall short a lot of times with our dental teams. We don't go to the depth that we need to in defining how we're going to do this, and then we set our team up to fail. Sure. So it starts out with, here's what we're going to do. The what would be asking patients for referrals. Here's who's going to do it. Well, whoever has the great relationship with the patient. Sure. Who are we going to do it for? In other words, which patients? The patients we like. We don't want to ask more patients we don't like. We don't want more of those, right? When are we going to do it? We're going to do it when that patient is having a great experience at the practice, right? Right. Where is not as important in this discussion. Where will be wherever it happens at the moment, right? The why, again, is because we're going to have patients coming in that already have a higher trust level with us. Sure. We're going to build a practice with patients that we want to have in our practice. And then the how is actually the verbal skills, the role playing, and the physical walkthrough. So we create that together. So that's the implementation process. And then we take all of that, write it down, and that becomes our standard operating procedures. And the most important part of this implementation process is that we're practicing this together as a team, that role playing. And I know everybody hates role playing. Yes, they do. But if we can't say it to each other, we sure as heck can't say it to a patient, right? So we want to be able to practice that. So that's the I. The S is for sustain. And here's where we definitely drop the ball in dental practices. We tried something out for about 2 weeks ago. Well, that didn't work. I don't like that. That's uncomfortable. Anything we implement new is going to feel awkward and uncomfortable until it becomes a habit. Right. And the normal range for a habit is 66 days. So if we're going to implement something new, we want to give it at least 2 months before we decide whether it was effective or not. Sure. So that's the S. And the E is for evaluate, ongoing. Did we implement this? Here's the accountability part. Are we doing it successfully? What do we need to change? Should we tweak the verbiage? Should we do this or whatever? So that's the R.I.S.E implementation process. When we do that consistently, it keeps us going because we're, first of all, committed for 2 months, and we're evaluating it, how are we doing with this on an ongoing basis.
And when do you bring about the second idea? I mean, yes, you've done that with the first idea.
Well, so once that first idea has become a habit and it's routine, we don't have to think about it anymore. Okay. We as humans like to operate on autopilot because we think we can multitask, which means we're just actually doing everything a little slower.
Absolutely.
Right? So once that becomes a habit where it's just a part of the routine, we bring in another one. what happens so often is we have a tendency to say, we'll do this and this and this, and everything gets watered down and we don't do anything.
You know, you do need a commitment, though, right, from leadership in
Absolutely.
terms of making sure that we're doing these things.
Absolutely.
Because obviously ideas are great. I mean, everybody gets excited, but unless you follow a process. And so within your camp that you do you help establish that process, the R.I.S.E process, or that
Absolutely.
saying this is the process you do, these are the questions you should ask in each step, so that you can get to a great implementation strategy for whatever initiative that you're planning.
So the Culture Camp is actually a mini rehearsal for future meetings as well.
Sure.
Because we use the R.I.S.E process throughout the entire Culture Camp to implement how we're going to communicate doing this, or the flow for this, or whatever it is. We use that process to go through and we define that. We use a big easel pad and markers and write it all down. It helps generate more ideas when people can see the thoughts that are have been shared already, and then we take that and we use that R.I.S.E process to go through and create, and it's an amazing day because it's a co-creation day. The team creates it. I more or less just facilitate and give feedback.
And this is fascinating. I think all of us need this help to implement ideas. I have a list of ideas on my thing, and I think co-creation is wonderful, and I'm definitely gonna start implementing some of these ideas with hopefully your help in our organization to really put great ideas into action plans and into strategies that drive us to success. So thank you so much for this great conversation.
Oh, thank you.
Thank you.